Hello, Professor. I didn't get a response from your email to see if I should just combine all of my videos together, or because I have access to my YouTube channel through my phone, so I'm able to do that. If not, then I would have to be doing this. Like I said, I'm at work, so I'm trying to do this as quickly as possible. Once again, I apologize for the misunderstanding. I sincerely thought, because it said like checkoffs, I said, okay, so this is what I did at checkoffs. I didn't know that I had to pretty much redo what I did in checkoffs. But for my midterm video, you know, it starts with a general survey. So what I would do, I would introduce myself, have the patient introduce themselves, make sure they're fully alert and oriented as they're talking to me. And as I'm asking, you know, what's their reason for coming in. I'm kind of checking the way their speech, the way they're talking to me, the way they're looking, you know, their stature, their mobility, if there's any physical or emotional or spiritual or psychological distress. I would also be looking at facial movements, kind of see how they're dressed, how they're groomed, their hygiene, their hair. I will be able to see also like their skin, whatever is available to see, kind of get like a general picture of them. Next, the skin. I mean, I could go ahead and just assess specifically to the skin. I'll check nail beds as well, look for any lesions, any wounds, any debris, any hyperpigmentation. You know, in regards to the head, I would be looking for any infestations, any debris in the head. I would also be palpating for size, for symmetry. In regards to the face, I'll be, like I said, be looking at for symmetry of facial expressions. I would be conducting cranial nerve 7, 5, 6, 7 for the facial, which is often something that we do with stroke patients. So, you know, we have them raise their eyebrows, smile, make sure everything's even, puff up their cheeks, squeeze their eyes shut. For cranial nerve 3, trigeminal, I will have them do the jaw movement. I will be feeling the clenching, any temporal masseter muscle strength with them clenching, and the TMJ joint. I would be hearing for any clicking or feeling for any snapping. In regards to eyes, something that we also do for stroke patients, we do the extraocular motor test, which is, you know, just follow my finger without moving your eyes. We would also be testing for perla accommodation, and here with the test, accommodation would be to follow the nose, make sure the pupils constrict and dilate. We are often doing it here at bedside with a light to see, or we see the pupillometer now with advanced technology. I'd be inspecting for the optic disc, for color, any sharpness. I'd be looking at the sclera as well, the cornea for any like discoloration, any I would also be looking for any edema, any discharge. In regards to the ears, I'd be just, you know, first examining the external ear, looking at structure, looking for symmetry, looking if there's any discharge seen, for any pain. Then I would go ahead and advance and do an otoscopic exam. I'd be looking into the tympanic membrane, the color, the cone of light, which at the right is at 5 o'clock, at the left is at 7 o'clock. I would also be assessing cranial nerve 8 acoustic with whisper test. So I would be at arm's length behind the patient. If I'm testing the patient, if the patient's right here, I'm on my roughly about left side behind the patient. I want the patient to close out their right. I would just do a series of numbers, a series of letters, and a whisper. I would whisper to it and have them repeat it. I'll do the same thing on the other side and have them close the other ear. Weber and Rhine test, I guess it's as indicated. Moving forward to the nose, I would check for frontal and maxillary sinuses with light pressure. I'd also be looking for any erythema, any swelling, any tenderness there. I would also just be inspecting the external nose for symmetry, for any lesions, any deformities. I would also I would put a cone light, in the nose externally, just to kind of see inside. Moving to the mouth, throat, I would externally assess for the lips, looking at the verbalian border, making sure they're pink, everything's intact, there's no scars, there's no lesions, no discharge, no scars, no cuts, pretty much the skin integrity. I will be looking into the oral, seeing if there's any, if it's dry, if it's moist, any thrush on the tongue, if they're, inspect the teeth. In regards to the tongue, there is cranial nerve 12. So we'll have the patient stick out their tongue, move it side to side, make sure there's strength onto that. I would assess the hard palate and the soft palate, looking for color, position of the uvula. Onto the neck, I would inspect the neck behind the patient. I would put my fingers, making sure, inspect for tracheal deviation, for any thyroid enlargement. I would also have the patient swallow. I would inspect the lymph nodes, which is the preauricular, postauricular, occipital, tonsillar, submandibular, and submental. Then we have the anterior cervical and posterior cervicals. We would be doing the cervical, though, the anterior one at a time, just to prevent for any blood flow to the carotids. Regarding the chest, the thorax, I would just first just assess kind of for symmetry, any deformities. I will then percuss, and then I would do it in a S shape percussion, and then I would also auscultate in an S way percussion, in an S way. I'm freezing out on the word I want to say. Just you would do the S way, the way you want to go ahead and auscultate. You don't want to forget at the right middle lobe. You would do that anteriorly and posteriorly. I think that kind of summarizes the midterm checklist for the video.